and a very warm welcome to today's Lunch and Learn, hosted by Dementia Adventure. Thank you so much for joining us. We're delighted to be joined by Roberta McKee-Jackson from the Rare Dementia Support, who will be leading today's session. Thank you, Roberta. We're really looking forward to hearing from you today, and I'm going to hand over to you now.
Thank you very much, Janine, and it's really a pleasure to be here and to have a chance to speak with all of you. Actually, I think quite a number of years ago, I heard a presentation in Wokingham about Dementia Adventures, which was really intrigued me. Just to give you a little bit of background, I come from a background of lived experience. With my late husband had posterior cortical atrophy and Lewy body dementia. So I've been, and he was diagnosed at Queen Square ultimately. So I've actually been around this space for 15 years more, something like that. So a long time. And I've been on staff with Rare Dementia Support for over 8 years. So I do have quite a bit of experience in working with different people that have these dementias. But one of the main things, I'm going to just give you a brief overview of what Rare Dementia Support, the services we offer, and the types of rare dementias that we support. So if it's okay, I will share my screen to give you some slides to look at.
Thank you, Roberta. That's great. Just to let everybody know that we are recording this session. So if you prefer to put your camera off, that's absolutely fine. But if you're happy your face may be in the recording if your camera is on.
Okay.
Thanks, Roberta.
Problem at all. Thank you very much. Just what we do say about this is basically that when we talk about dementias, we're talking about different people with different diagnoses and different needs. And that's typical of people with rare dementias. Very often when someone says, oh, I have a diagnosis of dementia, people automatically assume it must be Alzheimer's or maybe vascular dementia, because those are the two most common types. But in fact, there's probably more than 100 types. So it's always important to know what type the person has. So just to give you, okay, so for whatever reason, there we go. So what Rare Dementia Support is actually, we are a service that is commissioned under the Dementia Research Center, which is a part of UCL. And we really try to offer special social and emotional and practical services to our members. And this is not only the people who have received a diagnosis of a rare dementia, but their families, carers, friends, other people all around them. And it's really for anybody with those types of dementia, or supporting them is to have access to very targeted and tailored information. And how you interact with those people is always very helpful. So it really centers around 3 different parts, and that is support for the people. It also is about education. So we do provide education and training, not only to professionals, but also to other people that are living with the dementias, and raising awareness, as with any type of a condition, just like people with cancer are always doing things to raise awareness of specific types of cancer. But that's definitely a part of what we do. And then we're also heavily involved in research. So those are the things that we really work on the most. And this slide got a lot of numbers on it. The really important one is the one up in the top left-hand corner, talking about we have over 9,000 members now. And that's amazing, because when you think about, we probably had maybe 2,500 people or something. And when the GDPR rules came in 2018, it was only if some of those people came back and said, yes, they were happy to stay on the database. So effectively, we kind of started from scratch from there again. But it is a huge number of people we're supporting. So that's the important number on this page. What I'm going to talk to you about now really is about the different diagnoses that RDS, really supports, and there's 7. One is not listed on here, but I will explain that one too. And one of the first ones, the first one on the list, is about frontotemporal dementia, which is abbreviated as FTD. This is really a group of dementias that most commonly will affect personality and behavior, or perhaps language and speech. And it's because of the damage that's been done to the not only the front, but to the sides of the brain. And it's the behavior form, which is the most common one, is mostly called or referred to as behavioral variant frontotemporal dementia, or BVFTD, or just FTD for short. The main symptoms that we see with people with FTD are reduced inhibitions, a loss of motivation, a lot of with obsessions and compulsions, definitely changes in appetite, and a loss of empathy. They may also have difficulties with planning or problem solving or dementia or decision making. So that's FTD, and that's probably one of the most common types of rare dementia. And just to set the stage here, what we're talking about as rare or young onset dementias are typically things that are people exhibit symptoms before the age of 65. Now, there are some groups, some of the people that have these types of dementias don't actually exhibit it, or they're not diagnosed until they're well after 65. And that's okay, because we still support anybody. It's not an age limitation on here. But some of the others you'll realize, excuse me, can start much earlier. So the fact is that we coined the term, I guess you would say, rare dementias, because it's generally not your typical thing, what you expect of Alzheimer's or vascular dementia, which generally is in people who are much older, maybe in their late 70s, 80s, even after that. So that just sets the scene with that. One of the other ones, the second one listed there, is primary progressive aphasia. And quite honestly, that is the language form of FTD. So FTD can be in different types, but in primary progressive aphasia, it affects not only people's speech, but their language. And there are 3 different types, or subtypes, if you will, of PPA. One of those is progressive non-fluent aphasia. And this is really for people who have trouble producing speech and how they construct sentences. It often will not make sense to you. There's also semantic dementia, which is really about understanding what words mean. And the third type is logopenic progressive aphasia, and that really affects word finding. Now, the thing about logopenic is that actually stems more from Alzheimer's disease versus the behavioral variant FTD. So it's classed in that same area of PPA, but there is a difference. And each people that are diagnosed with PPA, it's always really important to know which type they have, because that makes a difference in the support that's offered to those people. The third type is posterior cortical atrophy, or PCA. This is really caused where there's visual problems, and that's because of a shrinkage at the back of the brain and in the occipital lobe. And that really, we term that as a brain sight problem, not an eyesight problem. Typically, if you've known anybody that had a diagnosis of PCA, they may have gone to their optician saying, oh, I need more different glasses or something like that. And to be honest, it's not their eyes that are the problem. It's really the connection between the brain and the eyes and how those messages are received. Some of those symptoms also would be visual and spatial problems with seeing what and where things are. They often will have difficulties when they're calculating things or spelling and writing. And they may have trouble hearing and also feeling where things are. So sound could be a problem for them. And some of the early issues that you might see are people who get lost when they're reading. So it could be on their, if they're reading a book or even on the screen, they lose their place for the reading. They also have problems with driving and parking, and often visual problems at work. So the next one is familial Alzheimer's disease. This is an inherited form of your regular Alzheimer's disease, but it is caused by a genetic fault and it runs within families. So typically people that have this will develop their systems well before the age of 65, and commonly that might be in their 40s and 50s. And so the initial symptoms of the FAD are usually similar to those of people that have typical Alzheimer's. So it's a memory loss problem. Um, and just because, maybe your great grandmother had Alzheimer's disease or somebody like that does not mean that it's genetically being passed down. When you see anything that's a genetic type of rare dementia, is because it passes down through a family and it will stick with generally one side of the family. So it could come through your mother's side or it could come through your father's side, but it might be grandparents, it could be uncles, it could be anybody like that. So it's not just because, well, somebody had Alzheimer's, so therefore mine must be the same thing. So it requires testing to actually figure that out. And as this says, there are less than 1% of all people that really have the genetic form of this. So then we also have familial Alzheimer's disease. Again, I'm sorry, familial FTD. So this one is, again, it runs down through families, very similar to the FAD. And that is the fact that it's oftentimes comes from people. Generally, it's people that have the behavioral variant form, but it can also happen, much less often, for people that have PPA and particularly the people that have the non-fluent form of PPA. And again, this is much rarer. So it's not something we see a lot of, but it's the behavioral variant is the most common one that we would see. And then we have Lewy body dementia. And Lewy body dementia is an umbrella term that we use, which also includes dementia with Lewy bodies and Parkinson's disease dementia. So a little confusing there as to how it's being often, but a lot of times people are diagnosed, say, with Parkinson's. And Parkinson's is a mobility issue, as most of you will know. But if you have any form of the Lewy body dementia, you'll see issues with not only your changes in your thinking and reasoning, particularly if it's involving visual judgments on things. It could be fluctuations in your thinking and memory problems. And this can change day to day or even hour to hour. It's not something that suddenly this person just doesn't have any memory for things any longer. It also can include the mobility issues, which is movement changes like maybe slowness or stiffness or falls. And then sometimes the sleep disorder that involves acting out dreams. And one of the most common things that we see is the hallucinations or delusions. And that's one thing that most people who have Lewy body dementia will think about. Again, the one that's not listed here is young-onset Alzheimer's disease. And of course, this is again called young onset because it often will affect people in perhaps their 40s, 50s, or maybe early 60s. In most cases, YOAD, as we refer to it, is not inherited. So it's just there are more people are more likely to have maybe prominent language, perception, or behavioral changes, as well as difficulties with memory. So I think what this illustrates more than anything is there's a lot of, if you look at kind of the symptoms and the reactions that people have, there's a lot of crossover from one space to the next. So it's always a little bit difficult to know exactly what it is. And it's one of the reasons that we know it's very important for people to have a good diagnosis. So about rare dementia support, we're all about really providing one-to-one support to our members. And there's a great deal of information about any one of these diseases and things on our website, which anybody can access. It's not restricted. But to be able to get this one-to-one access, you do have to become a member. And subscribing to membership is very simple. It's just a link, and you fill out a few questions online on a website, and that will send your information off, and then you will hear back from a member of the direct support team to actually ask you questions. But the things that we do offer there, which is very helpful to so many people, is the fact that they can give you practical and emotional support. And particularly once someone has received a diagnosis, this is not something anyone signs up for or that you expect. And the only reason you might expect it is if you knew you had a genetic type, either the FAD or the FFTD. But they will help you through navigating through social services and the healthcare services. Perhaps if you need additional additional determinations of exactly what diagnosis you have. So maybe somebody said, well, you have an early onset, but maybe don't tell you anything more than that. So they can help you in recommending places for consultants to further navigate that idea of which dementia, which rare dementia does my loved one really have. They talk to you about, as we said, about education, providing that. And then there's a lot of advice and guidance that we provide to people who are in different care settings, particularly in the later stages of any of the symptoms. One of the things I did want to say back on, there was a question from someone in the audience had asked before about, is there any way to know if PCA dementia without a DAT scan? Well, I think the important thing here is that we're not clinicians at Rare Dementia Support. We can give you some direction in that, but I can tell you something about this, and this is more from personal experiences. A DAT scan, or sometimes called a SPECT scan, is really measuring a specific thing. It's really to distinguish Parkinson's disease from an essential tremor. While one of the tools that is used to diagnose someone with PCA, and this is not the only one, but one of them is a PET scan. And this is actually something that's measuring the metabolism or the glucose in the brain and about your neurotransmitters. So it's looking to diagnose Alzheimer's or a different variant of a neurodegenerative disorder. DAT scans tend to focus on Parkinson's. PET scans have broader neurological or neurodegenerative applications. They also, the other things that are used, I know, in trying to analyze if someone has PCA, as well as things that you tell us or people tell us, is the fact is they will do I call it a spinal tap, I'm sorry, I'm from the US, a lumbar puncture, sorry. And they can do some things, and more things are now being diagnosed through blood tests, but that's, we're not there completely at this point in time. So the groups that we do offer is we actually have young-onset, we have groups for each one of the 7 rare dementias that we support. So whether that's PCA, the PPA, FTD, we have 2 for the familial, so the familial FTD or the FAD, the young onset Alzheimer's, and the Lewy body dementia. So anybody who is a member of RDS, and everybody in your family or anybody else who wants to attend these must be a member to attend. But that's one of the best ways for you to learn more about these groups. They're generally held, up until now, they've been held at least once a year. And then there's always information. Those are generally recorded. There's information on our YouTube site that you can find out more things there as well. So the other thing we have is actually small groups. And this is breaks down. So these small groups are really in a lot of different forms. Originally, these were what we call regional support group meetings, and the little map there showed you where a lot of these meetings were held. And it's not just the meetings, but also the density of where people were, our members were. But we also have regular online peer support group meetings, and those are for one is for carers and another one is for the people with the diagnosis. And each one of those are separated out by the specific rare dementia diagnosis. So they happen on a monthly basis. I happen to know because I used to help with a lot of these. For the people living with the diagnosis, so like people with PCA, they happen to meet on the third Monday of the month. And that was consistent. And there might be multiple ones. It depends on how many are in the group. Depending on the diagnosis, again, there's a specific time that those are held. Those are all facilitated by people from our direct support team. And then we have another set of peer support groups for the carers. And again, this is restricted to carers only, and those are held on a given Wednesday of each month. So for you to be able to find out about these type of things, you can always send a message to contact@raredementiasupport.org. And when you join, you will get a listing. They'll give you a lot of information about things that you might want to sign up for and to talk through. We also have different themed programs and workshops for members, and generally these are smaller groups, but you can indicate an interest in those groups. So we have some now I think are called about a rare it's when you're first diagnosed, and it's a much shorter thing. Some of the workshops go over 6 or 7 weeks. They're all different, but they are very much programmed. Some are talking about, as a carer, what you need to know as your care needs are advanced and things like that. We also, for the people who have been a part of our group, we have bereaved care support groups. And these have been going on now since 2017, and those are now held on a monthly basis. They're done online. Initially, we did meet in person for these, but quite honestly, it was much easier to do them online because people trying to get into London for these could always be a problem. And when we came across COVID, even all of our regional support group meetings went to online groups to keep them going where those had been people meeting in person. So another question that had asked was about, my husband has PCA variant, how to help, please. I would suggest that with any one of these groups, whether those are the peer groups, some of the theme programs, certainly the seminars or the large support group meetings. And we have another new method, which I'm going to talk to on the next slide. And that is the fact that we have now are establishing network hubs around the country. And that's because we are opening an RDS center in central London, the first of its kind in the world, which will open very shortly, actually, in the next few months. But we know not everybody can be there. So we actually want to establish hubs around the country, anywhere within the UK, so that people can get together. And these hubs have been set up. The first one started over about a year and a half ago for a couple of them. I helped a number of them get started. But it's bringing together not only the people with a diagnosis, but their carers or friends and family that want to come along. And it's all rare dementias together. To be honest, they generally will be maybe an hour and a half or 2 hours, and they meet once a month in someplace reasonable for everybody that's there. And they're facilitated by a professional member. And then it's the biggest part of these, and I think the biggest thing that everybody as members get out of this is the fact is you are meeting other people who are going through some of the same experiences or maybe dealing with similar issues to what you are going through. You don't have to explain yourselves when you get there. It's just an opportunity to meet, talk with other people. Sometimes there's presentations, they work in different ways, but more than anything, it's finding other people who are living through the same experiences you are. And we often find as people come to these meetings and realize, oh my gosh, you live 3 blocks away or something, and you wouldn't even known that otherwise. And in many cases, you would not know where these people are. So it gives you a brilliant idea of people existing and the friendships that have built up through the years with a lot of these people is amazing. And I had that same experience myself years ago when I started, when my husband was diagnosed with BCA. So they're cropping up. We also have through the UCL, we have this thing called the Dementia Trials Network, and they are setting up hubs in various areas. And so that's where we were looking for these. That's the drawing on the far right of your screen, and that we are setting up hubs that go along with those. So you'll see them in different places. I can't give you the list of all of them right now, but that's something that you can find out when you speak with send a message to contact at, because they will tell you about the hubs that are already in place. Now, there was somebody who had another question, said, I've supported clients whose partner has Lewy body dementia and found it difficult to locate support from them in East Kent. So would be interested to find out about resources that I, as the professional, and they could access. I do know, to answer that there are a couple of different groups in Kent. I think they've sort of split it up as North Kent and South Kent, that are starting up. I do not know if those haven't started just yet. Again, this is something you can find out through the direct support team. But there are hubs going in different areas. So that's why it's important that you check in with those people, and they can tell you if there's somebody there. One of the other things that's important to us is talking about diversity. And I think we often find that the people who sometimes receive these diagnoses typically are not as a diverse group as you would hope for. But we're trying to reach out to other areas. And what we've done is we have translated into, I think it's 13 or 15 different languages now, some basic information sheets to go out. And the one that you see here that's in the beginning is actually one that I will send you in the English version. But it tells you, it basically just explains the 7 rare dementias we support. So it's pretty much what I told you in that earlier slide. But we've translated that into more and more records to help people. And again, it's trying to spread this awareness. I did mention that we have a Rare Dementia Support Center that's opening later this year. I think the handover of the keys is probably going to happen within the next few weeks, and it will be sort of a soft opening. But the idea is that also we talked about not only providing support, but education and research. A lot of that will go through in this one place. And what happened is through a huge campaign that was sponsored by the National Brain Appeal, who is really how RDS exists, because they are a charity, but RDS is not a charity. We're supported by a charity. We're supported by the National Brain Appeal, which also is what funds the National Hospital for Neurology and Neurosurgery in Queen Square. But they raised an amazing amount of money for us to be able to purchase these 2 buildings, which you can kind of see they're old townhomes in Woburn Square, which is about a 10-minute walk from Queen Square. And that has been in the process of being retrofitted because there was all kinds of problems in those buildings, you can imagine, and they've been broken up. They've been used, originally they were homes for people, and then they were turned into various office spaces and things like that. So those will be coming out, and there'll be more and more announcements about that soon. And so the meetings for the individual groups, so like for FTD or PPA or PCA or something like that, I know for their soft opening, they will end up having people that come in for kind of an open house type thing. It cannot support huge numbers of people at any one time. So they'll be done one group in the morning, another group in the afternoon. But it's for people, this is really set up kind of on the same idea as a Maggie Center, which is set up for people with cancer. It doesn't look clinical at all when you go in there. It will be warm and welcoming to people. So it could be people who have come over maybe from either doing testing or after being diagnosed or something like that from Queen Square. And they can come over and find a warm and friendly place, a kitchen where you can sit down and have a cup of tea and chat with other people. So that's the idea behind that. So just in summary, that although we call them rare dementias, they're not as rare as sometimes we think. It is probably about 15 to 20% of the people diagnosed within the UK. But what we do know is the experiences that people have. There is a lot of crossover as you move along in this journey, and they provide such amazing insights, and lived experience is incredibly important. It's how we find um, all these things, that similarities between the types of rare dementias, but it's also really drives our research. So if we just ask a research fellow to come up with some ideas about what should we research, say, about PPA, they can come up with some great ideas, but it's really the lived experience of our members that directs a lot of that research. And it's much more relevant than to our members. People that take part in the research, particularly the people who have been diagnosed, generally they realize that it's maybe not going to have a significant difference to them, but it will impact people in the future. The other thing, the quality of the diagnosis is important, but it's not there for everybody. As I said, a lot of times people might just be diagnosed with young onset dementia, but they don't really know anything more than that. So I think the call to action there for people is find out exactly what dementia it is. Again, if you were somebody that was diagnosed with cancer, your next question would be, well, what type of cancer? Because just telling me I have cancer isn't going to help, because everything is different based on the specific type they have. So we need to do the same thing for people with dementias. And without that correct diagnosis or proper diagnosis, then there's so much that people miss out on, not only in the support that they might receive or plans that they need to make, but it's to understand and figure out, how do we adapt our life? We don't want people to have a diagnosis and then just become isolated. And unfortunately, that is what happens a lot of times, which is one reason these hub meetings are ideal, because people feel like they can go and they can meet other people. And then to misquote William Osler, don't just ask what disease the person has, but know what person the disease has. We need to know about that individual. And that the individual that has a diagnosis of a rare dementia, they're still there. Some things may change and they may not be able to do everything that they did before, but at the same time, there's a lot of other things that they can do. And you want to live every day and make it the best day that you possibly can. So thank you very much for your time. I'm happy to take some questions if you like. I will stop sharing in that way. Get back to the screen. But hopefully that was helpful. If you have questions or anything, as I said, please, you can send a question to me, but if you are already members or are not members already, you can go to our website. There's all kinds of links to join and become a member. And I would suggest that that's very important. And there's ways if you're professional to join as well, as for people who may have a diagnosis. And again, it's not limited to just immediate family. If you're friends supporting someone else, we have that in a lot of cases. So thank you.
Thank you so much, Roberta. That was fantastic. So insightful and incredible session. Really lots of information that you've shared there. Thank you very much. And congratulations on that beautiful new building or buildings, that the first ever Rare Dementia Centre in London. That's really amazing. Fantastic work. We hope everybody found the session helpful. If there are any questions, maybe we could just give 5 minutes for any questions. If anyone has anything to say, please just unmute yourself and ask a question. And if not, then we're looking forward to seeing everybody at a future session of Lunch and Learn that Dementia Adventure will be hosting in due course. Thank you again, Roberta.
Thank you very much.
Okay, I'll just check the chat if there's any questions in the chat. Lots of thank yous to you, Roberta. So, yeah, thank you so much. Well, thanks everybody for joining us today at Dementia Adventure Lunch and Learn. Enjoy the rest of your day, and thank you again, Roberta, for your time. Really lovely to hear from you. Bye bye.
Bye bye.